Welcome, everyone. Thank you all for joining us today for our panel, Social Isolation, Confronting the Silent Pandemic. I'm Scott Kaiser. I am a practicing geriatrician and the Chief Innovation Officer for the Motion Picture Television Fund, MPTF. We're a charitable organization that serves people who work or worked in industry through a variety of services, support, and charitable assistance. And we're here today to talk about this silent pandemic, social isolation, and loneliness. You know, in the midst of this global pandemic, another hidden public health crisis has emerged: loneliness, the subjective feeling that results from social isolation. The condition affects people of all ages and is a significant health risk, particularly for older adults and those with chronic conditions. A recent report from the National Academies of Science, Engineering, and Medicine highlighted the fact that social isolation has been associated with an increased risk of developing dementia and premature mortality. And loneliness is rising among younger people as well. Gen Z, in fact, surprisingly, they're being the most affected, and that's according to a major study from 2018. So during this panel, we'll hear from leading experts on how COVID-19 is exacerbating this loneliness epidemic, and we'll hear about the healing power of human connection. Now, before I introduce our panelists, if you could pull up the slide, please. I'd like to highlight a report that was released just last week, Together Apart, Findings from the Social Isolation Impact Summit. So back on July 1st, which frankly feels like several lifetimes ago, MPTF partnered with the Milken Institute Center for the Future of Aging to co-present a virtual loneliness and social isolation impact summit. So this report, you can see here, which is available online, really does a tremendous job of highlighting some of the key issues around loneliness and social isolation as it summarizes aspects of the proceedings from July 1st. So today we'll address some of the key takeaways and calls to action through this conversation today. And without further ado, I have the pleasure of introducing this wonderful, esteemed panel. Kim McCoy-Wade is the director of the California Department of Aging. Kim oversees home and community services for older adults across the state of California. And she's part of the team developing and implementing a California statewide master plan on aging, something highlighted in the report, something that I hope we will discuss today. And Linda Goller-Blount is the president and CEO of the Black Women's Health Imperative. As president and CEO, Linda has overseen more than $20 million of investment into Black women's health and research, and she's responsible for moving the organization forward in its mission to achieve health equity, as well as reproductive justice for Black women. Jeff Huber is the president and CEO of Home Instead Senior Care. Home Instead is the leading global provider of home care services for older adults. Jeff leads the company and its franchises in a strong commitment to addressing the challenges of the aging global population and is committed to promoting consumer choice in care. And last but certainly not least, Dr. Dora Hughes, Associate Professor of Health Policy at the Milken Institute, School of Public Health. Dora is an internist trained at the Brigham, where I did some of my geriatrics training. So go Brigham. Dora her work focuses on the intersection of clinical and community health, social determinants of health, health equity, healthcare quality, and workforce. All issues that could not, or have always been important, but are just absolutely amplified, magnified, of critical importance today. So to start out, I would just highlight again that even before COVID, more than 1 in 4 adults aged 50 to 80 reported that they felt isolated. That's even before COVID. And now we know these numbers have gone up dramatically. We've all experienced this forced isolation, being cut off, and all coped with it in different ways and all had different challenges. So I'd just like to begin by asking each of our panelists to share their perspectives on why you feel this is such a critical issue and why, with so many things to be concerned about, frankly, no shortage of things for us to be worried about these days. Why should we be concerned about addressing loneliness and social isolation? Why should this remain a high priority? And I'm going to start with Kim McCoy-Wade.
Thank you so much. As you say, anybody who's working with older adults or working with families and communities already knew that isolation and loneliness were major threats to our health and wellness as we age, to our sense of belonging, to our sense of purpose. But with COVID, it just amplified, underscored, put in all caps in a whole new way. Here at the state of California, we did two things. We started with our governor a check-in call campaign and called on people to make hundreds and thousands and tens of thousands and hundreds of thousands in phone calls. And the stories we heard back were too many times heartbreaking. Absolutely heartbreaking. People worried about where they're going to get the groceries in their house. People longing for their friends, their family, their grandchildren. Just great, immense need for that connection as well as for basic needs. We were very fortunate that with some Bay Area partners, we were able to take statewide something called the Friendship Line to provide a 24/7 place for older adults to call and get that friendly ear, that friendly conversation anytime, feeling a little bit lonely or having a more serious bout of depression or anxiety or behavioral health challenges. And we continue to receive hundreds of calls a day of people who are lonely and who are missing their communities, their families, their walks, their hugs. We do worry, particularly in our residential facilities, where there's been an even longer prohibition on in-person visits because of the deadliness of COVID. And again, we are seeing it in a crisis line that we run there of people desperate to see family and friends, desperate to see their loved ones, particularly with dementia. But all families have these needs. So it is just opening those channels of communication has revealed so much pain and so much need that we are really trying to double down on everything we can do to make connections happen safely, restore services, but also rethink connections and services. How can we make sure older people are included? How can we make sure the digital divide is bridged? How can we make sure that ageism and racism and other prejudice aren't keeping us apart when we should be connected? So it's really a call to transform our communities, our services, our relation to each other. It's terrible that we're here, but it is really a challenge to us to make it a transformative leap forward.
Jeff?
Yep. Thank you, Scott. I think it's such a critical issue for a simple reason, and it's that social isolation and loneliness kill. Just as human beings require food and water and sleep, and we need human interaction in order to thrive and survive. So before you listed some of the risks, before the pandemic, seniors who are lonely were at a 30% greater risk for heart disease, a 32% greater risk for stroke. They're at dramatically increased risk to be subjected to scams. And because of all of that, they have a 45% increased risk of mortality. So loneliness kills. And if you want evidence of that, since the start of the pandemic, we've seen 13 to 15,000 more deaths from Alzheimer's and other dementias than prior years, more than we would have expected this year. The deaths from COVID in nursing homes is well documented, but these additional 15,000 deaths I'm talking about aren't due to COVID, but due to the social isolation that has come with it. And it's because it's rapidly accelerating the disease progression. And so sadly, these people are dying alone. Over the weekend, I saw an article about a nursing home in Greeley, Colorado, where the residents were protesting and holding signs that said, "I'd rather die of COVID than die alone. No one should die alone." And that's why my platform as the CEO of the world's leading home care provider is to eradicate social isolation and loneliness for seniors. And we do that through our core business with a professional caregiver in the client's home, which is the safest place to keep them. We know that human interaction is the antidote to loneliness. And so we're making big investments in technology to extend our high touch business with technology. But we're also doing that through other ways, like free resources for family caregivers and training. People can go to caregiverstress.com and be equipped with education and tools that help them take care of their loved one. We're doing that by financially supporting nonprofits through our home instead charities. Less than 1% of all philanthropic dollars go to senior causes, and we want to change that. And most importantly, we're trying to eliminate social isolation through a social movement called Ready to Care. We can solve this problem tomorrow if everybody just did a little bit and reached out to socially isolated seniors in their communities. So, I would love everybody listening in to go to readytocare.com and sign up. And every Monday, you're going to get a tiny little text message with a little bit of inspiration, a little bit of education, allow you and inspire you to take small acts of care to take care of the seniors around you. You can even go and become a pen pal and write a letter to an isolated senior.
Excellent. Thank you, Jeff. And so really hearing from Kim about the spotlight on this issue, the critical nature of this issue amidst COVID, from Jeff about how loneliness kills. It's always killed. It's just now we need to deal with it more than ever. Dora, going around the horn here again to open things up, why should we care about this issue?
Yes, thank you for that question. And I just also want to start by giving thanks for inviting me to participate on the panel today. I am here to represent the public health perspective, and public health is concerned with promoting and protecting the health of people in the communities where they live. That is our core mission, and that is why we care as the public health community about social isolation. As Jeff just laid out, social isolation kills. When we think about chronic disease, we know that social isolation carries the same risk as that of smoking 15 cigarettes a day. It carries similar risk to obesity and physical inactivity. Social isolation also is associated with about a 50% increased risk of dementia, is another startling and certainly distressing statistic. And I think to your point, Scott, loneliness is pervasive, even pre-pandemic, with more than a quarter of adults age 65 and older considered to be socially isolated, and even more if you consider, almost a third if you consider those that are 45 and older. So for all of those reasons, we cannot achieve our core mission as public health professionals without addressing social isolation and loneliness. And I look forward to getting a bit more into some of the solutions that we're seeing as we continue this conversation.
Excellent. Thank you so much. And now coming back to Linda, we're quick on our feet here. Hopefully we've got all the tech issues solved, and waiting with bated breath to hear your take.
This issue is really critical. For 400 years, Black women have been undervalued, dismissed in this country, and all of that is loneliness producing. But what we had was each other. We had our families, we had our friends, our social networks to depend on, to take our issues, our concerns, our anxieties, our depressions for support, for solace. And now here we are with COVID-19, where we have to enforce social isolation. And so this goes to the core of how we interact as family, as community, our responsibilities as women, as mothers, daughters, sisters, to care for others. And suddenly now we're in this position of not being able to do that and not receiving the kinds of support and network that we've come to rely on and needed, frankly, just to deal with the issues of being a Black woman in this society. So my concern is, we're 8 months, 9 months into this. This goes on about what the impact can be. We've already talked about. I'm concerned about the emotional impacts and what the what the effect will have on our communities, on our family structures, on our ability to do things like care for our parents or care for our elders who may be in facilities, and what this might mean for a Black woman's psyche and her sense of self. We're already beginning to hear women talk about letting their families down and letting people down, not living up to what's expected. And so this is a real concern for us, that Black women will further internalize this negativity and frankly the destruction that comes from when your social network is disrupted. So I'm looking forward to the conversation.
Thank you, Linda. Now, as we move on here, I was reviewing this excellent report again, the Together Apart report, findings from the Social Isolation Impact Summit, and want to acknowledge the great work of the Milken team on that, and the supporters of that report, AARP Foundation, the SCAN Foundation, and the Gary and Mary West Foundation. And Kim, as I was looking through that report, I saw a comment from you that you talked about there's not just one loneliness story, but many. And really, again, I think even in your opening comments, you started to put a face on the issue and really spoke to the way that face has been characterized, revealed in this situation. So can you tell us a little bit more about how that ethos, that not just one loneliness story, has informed the approach across California to addressing loneliness and isolation, particularly in the pandemic?
Absolutely. We have been on a year-long listening and collaboration process with our state to plan a 10-year roadmap for aging. And we have just heard so many aging stories and now so many COVID stories. So let me just give a couple examples. You can imagine, and you yourself may be somebody in your 60s who's thinking about, what does this do for my retirement, my inclusion at work? Am I isolated from my job? Am I missing job opportunities, financial opportunities? Am I not seeing my grandchildren, helping my children care for their grandchildren? That is one story. Somebody who is perhaps closer to 100 in a residential facility, maybe has children in town, maybe has children across the country, maybe doesn't have children. That is a different isolation story. And I think when you look, and there's many, many, many in between. Aging is a journey, and COVID, of course, has been a journey and continues to be a journey. I think one of the things we have seen very clearly is that housing and care and isolation all go together. And having housing that supports your care and supports your connection is critical. And the key for Californians and for all of us is to have options at the different ages and stages of aging. So it may be that building an in-law unit in the back allows a multi-generational family to be together in an affordable and sustainable way and encounter isolation. So you see places like San Diego making it even easier and more affordable to build in-law units. It may be that we need to rethink senior housing and think about multi-generational. So you see places in the Bay Area blending affordable housing for seniors with foster youth aging out of the system onto different areas of a residential building. It may be that in a residential facility, we want to create smaller communities. The word communities come up a lot. So how do we turn kind of large scale residential facilities into a community of small homes that can all be there and be more home-like, again, supporting home, health, and isolation, inclusion instead of isolation. So I think no matter what age or stage you're in, what your community is, what your finances are, what your ability or disability might be, we want to make sure there's an option that doesn't just think about, do you have a roof over your head? Do you have good cholesterol score, but also is equally valuing your inclusion, your connection, your well-being, as all three of those things have to work together to age well.
So, with that, I have to go to Dora, because everything that you brought up there had there's so many underlying policy implications, and really framing this as a public health issue, right? The incredible National Academies report, a lot of the thrust of that report was elevating the profile of this as a public health concern on par with smoking, obesity. So I'm just wondering, as you listen to this, Dora, and in your work, I mean, again, at this convergence of community health, social determinants of health, health equity, healthcare quality, Can you just help us frame this a little bit as a public health issue, and then extend into some of these underlying policy drivers that could help us begin to address it?
Sure, and I love that you went there even before I had a chance to go there myself, because I was just thinking from listening to Kim and her examples and some of the work that she's working on, that it was just emblematic and really helping to underscore the shift in the public health response, because all of what she's describing is what we would consider to be part of the public health response. We would invite Kim to join our tribe. And I think that in part, it very much we've started to see this evolution in public health. It is focusing more on populations. There is this increasing embrace of multi-sector partnerships spanning public health, healthcare, and social services. I would say certainly this change started pre-pandemic, certainly, but I think the pandemic has really helped to accelerate these partnerships and underscore the need for such partnerships. And when you think about, to your question, like what is driving these partnerships? First, there is now a much greater understanding that social determinants of health, the conditions in which we are born, work, live, and age, are the major contributors to health. And frankly, outside of the realm of what we used to be considered strictly health. Social determinants of health include socioeconomic factors, which include social isolation and loneliness, and those factors contribute to 40% of health and longevity. Second, I would say historically used to see the various sectors working individually. The housing authority would work on housing, the food banks would work on food insecurity, healthcare would work on health, and really focus on individual needs. And so now, as you think about what Kim just described, we are seeing these sectors working together. Because as you might imagine, if you need assistance with housing, you very well may need assistance with food. And if you're a senior experiencing social isolation and loneliness, you may very well need help with transportation and perhaps community safety, which is another social determinant of health, is a factor. And so third, as these sectors have started to pull together, there has been a shift from addressing these needs individually to think, how can we work to address these needs for an entire community or population, and with a focus on the root causes. And so it's very classic, as Kim described, we're not just thinking about how can we address housing needs, but how can we address housing plus care, and thinking about how do we create community, moving away from one person at a time, but for an entire area, an entire community, that's more a place-based approach. And so I think it's notable in some parts of the country, the public health officers who are leading these efforts are called the chief strategists, and really pointing out that they're more looking upstream to think about the policies, the regulations, the funding that's needed to address this at a higher level than, again, focusing on the individual efforts, although certainly those are important as well. So I hope this starts to give a flavor of what your the public health approach to this and addresses your question.
Oh yeah, I mean, my only answer would be yes, yes, yes. Thank you, thank you. I know we're not supposed to get political here, but you have my vote for anything and everything. Blank check vote. Yeah. And you said something at the top of your comments that you said the key word partnership. And we talk about silos and bridging these silos between health system and payer, but often a missing link in partnership is individuals and families and caregivers, right? So I'm looking to Jeff here. We know that loneliness and isolation is something that disproportionately impacts caregivers, both family caregivers, unpaid caregivers, and paid caregivers. And you're doing incredible work, Jeff, to support your professional caregivers, who by extension are also there to support family and unpaid caregivers, right? So can you speak a little bit about to how we really close the loop and bring individuals, families into the circle here?
Well, we're trying to raise awareness about this issue on multiple fronts, and we agree that we have to bring the public sector, the private sector, the social sectors together to help solve these challenges. For our part, We're trying to do that on a couple of different ways. The first is just through our core business. For us, it's all about connecting seniors with the people, the activities, the things that give them meaning and purpose in life. The very founding story of our company was based on our founder's grandmother, who was in her late 80s, socially isolated and very failing and declining health. And once she got reconnected, her health took a U-turn and she had 11 more fruitful years. So we're trying to advocate for professional caregiving as a solution and trying to use technology to expand our reach. But beyond that, we're also just trying to create a social movement, trying to raise awareness about this issue by getting our communities involved and putting effort behind a movement that we've created called Ready to Care. Because I guarantee that every person who's listening to this session has a senior on their block, down the street, around the corner, in your building that is suffering in isolation. And if you don't now, you very soon will. So Ready to Care is about getting everybody involved, giving them a little bit of education, awareness, and a call to action to do simple acts of care. And then additionally, we're trying to create the next generation of leaders who understand aging and the issues that come along with it, most notably social isolation and loneliness. So we've created this opportunity for your young people to have a paid year of service, much like Teach for America did, to understand the challenges of inner city education. We want to create the next generation of leaders who understand the challenges of aging and then go on to become change agents. It's a program called Champions of Aging, and we've partnered with Service Year to help create that movement.
That's great. That's excellent. And so, we know that caregivers are a disproportionately impacted group, and we know that lots of anybody really who identifies as part of a marginalized community is at higher risk. So, Linda, coming to you, thinking about the experience of loneliness and social isolation in communities of color, I want to flip it a little bit here because I heard you speak at a previous event, and you were sharing information about the Black Women's Health Study and how your organization supported a secondary analysis looking at people who really were doing great and understanding the factors. So I'd love to hear a little bit about that, but also apply that to this with loneliness and social isolation. How can we look to experiences in communities of color, Black and Brown people, really, as models of healthy social connection and healthy community?
Yeah. Since we've been talking about health disparities, let's go back to the Heckler report. It has always been from the perspective of what's wrong. And it was interesting in looking at the Black Women's Health Study, which has some 60,000 participants. When I started at the Black Women's Health Imperative, did a study. We asked Black women to just define health, just give us words and phrases. Most of what the words and phrases Black women used to define health were psychosocial. I'm calm, I'm at peace. Very few of the words and phrases they used had anything to do with physical health or disease state. Then we went to the Black Women's Health Study and said, is everything wrong? Is that it? It's just all bad. And they said, well, no, in fact, we've asked Black women to rate their health, and the majority of them actually rate their health, self-rate their health as very good or excellent. So I said, okay, wait a minute. If that's the case, then maybe the way we're coming about talking about health, our approach is backwards. Because if we don't view ourselves as broke down, then the public health community shouldn't view us that way either, nor should the medical community. So what that did is allowed us to reframe our work and start looking at our work through an asset-based lens rather than a deficit-based lens. Because if we view ourselves as okay, Black women were saying, if I can get my mind right, my spirit right, and my money right, I can take care of everything else. Yes, diabetes is important, but it's not the most important thing. And so in thinking about loneliness, and particularly the role of COVID-19, we're having to tap into that and ask that question: what does it mean to be a Black woman living in this society in this time? and what kinds of resources can we help her weather these storms and to deal with the loneliness issues, but also, again, fulfill her responsibilities. Black women are bringing people into their homes. They're bringing their elders into their homes to care for them. But of course, that means that raises everybody's risk for COVID-19. There's this expectation that we will take care of people, that we will do what we need to do in our churches and communities. But we've got to make sure that we take a strengths-based approach to giving women the kinds of resources they need. And just to touch on what Dora said, yes, so, we talk about social determinants of health all the time, but we also have to ask ourselves why these social determinants exist in the first place. And so culturally, where we may not be socialized to complain and we may feel guilty about complaining, about feeling lonely, we have to look at society and look at the barriers that exist that actually reinforce those feelings of loneliness and prevent us from actually making the kinds of connections that we really want to make. And so that's what we're focused on now, especially to make sure that women can find those connections and then maintain those connections.
Absolutely. I mean, and at a moment now where we really are putting a spotlight on issues that they're not new, but putting the spotlight on these issues. I was really interesting article in Health Affairs about looking at health disparities and not sort of skirting around racism as a driver, calling it as it is. And I was struck in preparing, I read an amazing article looking at the impact of racism, the intersection of the experience of racism and the feeling of chronic isolation, loneliness. Is that something that has come up in any of the incredible work that you've done? A theme we should be tuning into?
It does, because we have felt isolated for generations. I mean, who are Black women going to turn to but each other for support? Who is going to understand their lived experience? Who's going to understand the experience of going into a store and having the store clerk follow you around? Who's going to understand showing up in the emergency department in incredible pain because you're having a sickle cell crisis, and what you're met with is, oh, you must be drug seeking. So this absolutely is coming up. And when we look at the statistics of our infection rates and death rates among Black and brown people, as many as 7 times that of white people, depending on where you are, what we're getting is, oh, it's because you're Black. But of course, we know that's not the case. And so 9 months ago, Black women were ignored. Now we're essential workers and get to go face an often unmasked and angry public and then come back home. So yes, who do we turn to? So this is really critical as we think about how society is organized and who's valued and who isn't, and what kinds of supports are put in place to help people not only now through this forced isolation for very good public health reasons, although had we had an appropriate public health response 9 months ago, 10 months ago, we wouldn't be in this place, but to create an environment where people can feel valued and feel supported and feel like they're appreciated.
I'm going to jump in because there's a pause and there's so much that you just said that has been informing the California thinking and California work. I just want to lift it up. Thinking about how this is not an individual issue, and this is Dora's point too. This is families and communities, and centering people in families and communities of their choice. Families in the biggest, broadest sense, and so it comes up in so many ways. When you think about where childcare was 20 years ago, and the attention that the closure of schools and closure of childcare is getting right now, I almost feel like our field is 20 years behind, and people are just beginning to realize how central caring for our elders is to whole family life, whole economic life, what it's doing for us as we're trying to do it all, and care for our parents and our children and our work, and maybe do some school on the side and somehow get the groceries in too. I think that whole family situation of this is so important, because families are who's keeping people healthy, but also keeping people connected. And we're certainly at the state very much thinking about the holidays coming up.
I'd love to hear kind of Dora's perspective from a public health view. of the role of guilt. I mean, we are isolated, but then when we try to get together, when we try to deal with those feelings of isolation, Black women in particular are made to feel guilty about some of the choices they're making, but they're trying to take care of their family, their friends, their children. They're trying to work and homeschool and meet all of these expectations. There's this syndrome, the sojourner syndrome of just taking on so much responsibility. So I wonder about what this is going to mean months from now, of the guilt that we've taken on and internalized for simply just trying to make the best of this COVID-19 situation.
Yeah, I'll just say two very brief comments that we're looking at in the question. And just to repeat the question for our audience is, how do we continue to lift up and strengthen community partnerships of all kinds, place-based community, cultural community, all kinds of communities? And I would say two strategies that we're looking at very briefly at the state. One is, how do we make it easier for health plans to partner with social and community organizations? As we know, these things go together, but it is very hard for a major health plan to partner with a local, community-based, cultural-based organization to provide visiting, to provide meals that are appropriate. So how can we make that easier, policy-wise, contracting-wise, funding-wise? And then the other piece I would just say is, and you touched on it, Dora, is the virtual care. The experience of pandemic with broadband and the experience without are night and day. Whether it's for healthcare, whether it's for your loved ones, whether it's attending your religious service or a class online, whether it's ordering those household necessities, that is key. And so we're really thinking about, how do we equip our excellent community-based group with the devices, the broadband, the training, so that that senior center can be online, that adult day health can do a virtual check-in. What are the ways we can get the best of both worlds from the community group? So those are two of the thoughts on our mind, the health plan partnership and the technology partnership. But I'd love to hear from, let's see, Linda, do you want to suggest what's on your mind in this area?
Yeah, you actually raise a really critical point. In the reproductive justice world, we talk about intersectionality. And Black women live at the intersection of racial oppression, gender oppression, economic oppression. And so you've highlighted a really important point. Telehealth, connecting via video, great if you've got enough broadband speed. If you don't, you can't do it. So you can't participate in telehealth. You can't do the connection that you can't do live streaming of your church services, or if you're in the adult daycare, you can't connect. So this also highlights another inequality of many in our systems. And, while we're talking about the role of community-based organizations, and I absolutely agree with what you say, Kim and Dora, this is not only an issue, loneliness is not only an issue of lower income people. This spans socioeconomic status. So whether you're a well-off person or not, you're still made to feel the same sort of sense of loneliness. And part of what we're trying to do is help providers understand this and to look for it and ask for it, ask about it. If they can see into the home through telemedicine, I've had a number of providers tell me, I get a better sense of how people live, and that is actually I'm able to improve my care. But if they can't, of course, they don't have that opportunity. But the point is, people up and down the SES ladder are feeling this, and we're hearing this from the Black women we serve at the higher end and Black women we serve who have few resources, that they are made to feel as though they are in this by themselves and don't have a place to turn to. So we really need to think holistically about how we provide these opportunities for connection with everyone.
Absolutely.
And I think to your point.
Go
sorry.
ahead.
No, I was thinking to Linda's point that I came across a startling stat that about 500,000 of seniors go more than 6 days a week on average without seeing anyone at all. And that's just crazy. And that was pre-pandemic. And so you have the severe and worsening crisis with social isolation that I think can't be understated. The only point, and then I'm going to be quiet, is one of my favorite public health models is actually being implemented in California. The California Accountable Communities for Health Initiatives, or CACHI. And that is a type of model that is purposely building these multi-sector coalitions that, again, are including public health, they're including healthcare, including social services, community-based organizations. And to Kim's point, many of these accountable communities for health actually include participation by health plans that are donating their time, they're donating their talent to really helping to address upstream the needs for the communities that they're serving, both focusing on the individual needs, but also how do we change the policies in the community that, as an example, can help lead to more in-law suites being built or more affordable housing. So I just, so many of the points that the panelists are resonating with me, and exactly the public health approaches that we are seeking to emulate in more states and more local areas.
So I think as I'm back here, I just want to, obviously this panel is much better off without me, but we do want to hear from the audience. We've started to get some audience questions. I'm not sure the protocol of how you submit a question, but get them in. Definitely, we want to hear from you. We want you to feel connected and engaged, right? That's what this is all about. I'm looking to Jeff here. One of the other calls to action from the report was to broaden the availability of continuing education and information to caregivers to increase resiliency and protect health. So I know I've been coming to you on caregiver issues, but I just don't think it could be stated enough. Let's go deeper there.
Well, you're right. Since the very beginning of the pandemic, our caregivers have been really frontline responders, providing life-saving, life-sustaining relationship-based care all around the world. Pre-pandemic, it was a difficult and lonely job already. Post-pandemic, certainly our caregivers not only have seen the effects of COVID on their clients, but they've been feeling the effects themselves, the additional stress. And so that's why, is trying to support them. We created a 24/7 support line where they have unlimited access to trained professionals so they can help nurture their own mental health. We talk a lot about caring for the whole person at home instead, and certainly caring for the emotional, spiritual, physical, and mental health of our caregivers is of paramount importance. But then the strain on family caregivers who do most of the caregiving. And, as it was mentioned earlier, not only are they dealing with the effects of COVID themselves and the isolation they're facing, but they're having to be a teacher now, and the feelings of guilt that were mentioned earlier by not being able to be physically present with their loved ones. So we do a lot to support family caregivers through free resources site. You can go to caregiverstress.com and find all kinds of helpful tools and information and education as family caregivers are trying to support their loved ones through this pandemic.
And Jeff, I mean, all caregiving is a heavy lift, but obviously caring for somebody who's living with dementia poses unique challenges. And as we know, loneliness and isolation are both associated with increased risk of dementia, but also a burden that a lot of caregivers of people with dementia have to bear. I'd be curious to hear more from you on that. And also just note that the Milken Institute has recently formed an alliance to improve dementia care. And obviously, this is so critical, and this convergence of social connection, caregiving, dementia. I imagine this will be a big part of the thrust of this collective going forward.
Well, you're right, and not only dementia was a pandemic before the pandemic, but because of the pandemic, as I mentioned earlier, it's really accelerating the progression of the disease, and people are, because they're being socially isolated, and their disease is accelerating much faster, and we're seeing a much greater increase of death and because of and prematurely because of the pandemic. So I think that it bodes well for not only home care and professional caregiving, but providing family caregivers with the tools they need to care for someone with dementia. So that's why you can go to caregiverstress.com and basically receive the same training that we offer to our professional caregivers free of charge, just as our way of helping to support family caregivers who are supporting a loved one with Alzheimer's or other dementia.
Yeah, Jeff, it's true. I've seen in my own patients and in the population we serve, I've seen people decline dramatically uh, as a result of COVID precautions, and it's really devastating. I think that actually connects with a question we've gotten from the audience about really how do we facilitate connection. We're all dealing with this tension. I've been there at the AL level, at the nursing home level, out in the community of how do we keep people safe and protected from the transmission of this dangerous virus, and how do we keep them engaged and connected. So the question was about, um, you know, it seems in-person contact would be the best way to address social isolation and loneliness, but how can we better use technology to help bridge the gap? And that's really something any of you, I'm sure, could speak to. I know there have been some incredible things going on in California. Who wants to go for that one?
I'll
I'll
start, and
jump
I'll
on
just
that
say,
one. Go ahead.
there's no wrong answer, and there's so many ways, and don't let the tech intimidate. So let me just say the telephone is a fabulous technology innovation. So calling people continues to be a wonderful thing to do. And I would just, as we approach the holidays and people will be seeking connection, if nothing else, pick up the phone. That said, there are also breakthroughs in voice activated technology, some of these devices where you don't have to have a username and a login. It really is worth exploring, even with folks who maybe didn't spend their career online, if some of the voice activated technology is user enough to work. Lots of great guides on this. I'm so grateful to all the people creating digital content, whether it's religious institutions, educational institutions, art institutions. In some ways, things are more inclusive than ever before if you can get online. And then I'll also just say, there's great innovation happening. I personally am using a new app called Marco Polo to do video text with older family members who can record video text so I can see them and see their house and they can see mine and see my children. So I think it is both about the tried and true, the telephone, the FaceTime, the things that the people are familiar with, and then also introducing maybe those user-friendly technologies or even hot off the presses innovations as breakthroughs.
Excellent. Jeff, it looks like you wanted to jump in as well.
Yeah, I agree with Kim that where possible, low tech is probably the best best possible solution. There's a saying that in the age of machines, humanity is the killer app. But where that's not possible, I think technology can be a fantastic way to bridge that divide. Recognizing years ago that we needed to bridge the digital divide into our clients' homes, we partnered with an organization called GrandPad and took their tablet, which they developed over the years in conjunction with their senior advisors. They call them the grand advisors. These are people in their 80s, 90s. Even one of their grand advisors, Elmer, is over 100, and they've iterated and eliminated all of the friction points. A cellular connection being the best way to not deal with Wi-Fi, for example, or how the speakers work, or how the screen works with somebody in their 80s or 90s, and how their skin qualities change and don't work with the screen. So they've modified the screen. So we've taken that, and now we're using it as a caregiving tool in addition to being there for the client, but allows us to connect with our client when we can't be there in person, and allows our client to connect with their families and to the office. And so it's just been a fantastic way for us to bring technology to help solve this challenge of social isolation and loneliness.
That's a great example, again, where you just remove the, GrandPad really immediately focused on how are we connecting people. And then, solving for all the tech issues as opposed to accepting the tech issues as a given that can't be surmounted. But I have to say, I'm biased. Kim, thanks for the shout out for the telephone. We've been doing a lot with the telephone at MPTF, and we've developed a platform to support community organizations with social call programs. You can learn more about it at joincallhub.com. We have another question from the audience, which is I don't know where this came from, but thank you for this great question. Despite issues in generational conflict, and we anybody who's on social media saw an amplification of generational conflict surrounding the pandemic. How do we create more intergenerational connection to address the crisis? And again, I know each of you could share great things on this. So I'm going to have this as a toss-up. Intergenerational connection as a solution to the isolation problem.
Well, I'll just jump in. Some of this is actually happening because the economic fallout from this poor response to COVID-19 is actually forcing families to live together. So it's increasing the number of multi-generational households, which comes with its own set of opportunities and challenges, perhaps. But one of the things that we're talking about to women is check on your friends and relatives. Be your sister's keeper. Pay attention to what people are saying, how they're saying. Look at them if you can do video chatting. Really pay attention. And when somebody says, "Oh, I'm fine," when you know they're really not, we say, mind your sister's business, mind your brother's business, get into their business, drop off food to neighbors, run errands, just drop a note by and say, "I was thinking about you." Scott, to your point, check on people. And because we have a youth-focused program called My Sister's Keeper, it's a great opportunity to speak to high school and college-age young women to say, check on your grandparents. They need you now more than ever. And hey, you might actually learn something from them. So we're encouraging that kind of cross-cultural, and it is cultural and cross-generational conversation, which I think helps everybody feel a little more connected.
Absolutely.
Dora, if I can jump in there, I think that's just a fantastic advice and a call to action for all of us. I'm glad you have the platform you have. That sounds incredible. I'll mention again the one that we're trying to get young people engaged in this conversation through Ready to Care. It's a really simple thing. You go into readytocare.com, you sign up every Monday, you're going to get a text message that gives you a little call to action to take care of people in your community. And then we just, the next 30 years is going to be a massive surge in the oldest of the old. So if we think we have social isolation and loneliness issues now, it's going to be exacerbated over the next 30 years. And so trying to get young people to understand aging as a great destination for their careers. So we're trying to inspire young people to get involved in aging. I'll talk about my own daughter over the summer. She's a sophomore in college. Her job over the summer went away. She worked in restaurants. So I suggested that she become a caregiver. And it was an eye-opening experience for her. She was in social work, studying for social work, and now she's thinking about geriatrics as a career. So I think those are the kind of opportunities where we can bring intergenerational things together. For the first time in history, we have 5 generations working in the workplace together. What an amazing opportunity for us to bring these generations together.
Absolutely.
And if I can just build on that, I mean, we're also really encouraging young people who may be feeling despair and confusion and overwhelm about this moment, that your elders have been through tough times before. Your elders have been through the draft, have been through the civil rights movement, may have been interned in internment camps out here in California, were alive when they were discriminated against, may have been alive when they weren't allowed to vote, have been through the AIDS crisis, have been through a lot. And so to reach out to your elders and hear those stories of change, of challenge, of resilience, of community, it can really be a chance to learn your history and to build the future together.
Absolutely. And if our crew could just pull up that graphic together apart slide one more time, I just want to highlight that again, because I get this wonderful question that about intergenerational connection. The Eisner Foundation, which focuses exclusively on supporting intergenerational connection, also highlighted in this report. So please do check that out. And again, I bring this up just as to express my appreciation to the Milken Institute for including this session, for giving all of us this platform to discuss this critical issue. We've been yelling it from the mountaintops. We're all in this together. Connection matters, and now I think we're all listening. So with that in mind, in our last minute here, I'd really love to just go rapid round the horn. Any closing thoughts, sentiments The floor is yours. Let's just go around. I'm looking at my boxes. Let's start with Linda.
I'd say my closing remarks are: be your sister's keeper. Mind her business.
Jeff?
Well, I'll tout Ready to Care again. This is a way for everyone to get involved, and I'll also support the phone as a great technology. I think comedian Greg Goldman said once that my phone is a seldom used app on my phone. So let's get it out and let's use it.
Dora?
I would say that we need to continue to prioritize social isolation as a social determinant of health, and even post-pandemic, continue to advocate for greater funding for the services and supports that our seniors need.
Okay, Kim, bring us home. Represent California well here.
I don't know that I can add to the wisdom you've already had, but I would just say, this isn't just about the people who reach out to people who are feeling isolated. Also, if you are feeling isolated, I have no doubt that people who are listening to us right here, that there are some people who are feeling isolation, maybe for a moment, maybe for a longer time. But just urge people to reach out, make that call, let someone know. And if that person doesn't connect with you, you make another connection. But really, it's a 1 a day, it's a 5 a day. We all have to stay connected by any means necessary the next few days, the next few weeks, and for the months to come. We're in this together.
Wow, thank you, Kim. And I have to say, I feel a lot better knowing that I'm connected to each of you in this work. And I know we're at time. I really, again, want to thank all of our panelists for their excellent contributions today and their contributions through their incredible work each day. We are in this together. Check out the Together Apart report on the Milken Institute website, and everybody stay connected and be well.
Thank you.
Thank you.
Thank you so much. Bye.